morning. Good to see you too.
Morning, Kim. Kim times two and Dawn. All right, I think everyone has come in off the waiting room. So, Angela, I think we'll turn it over to you. I know we lost a little bit of time there, so I'll give you as much as I can back.
Oh, okay, no problem. Hi, everybody. Just good to be here. I am currently I'm an internal medicine physician, and I'm also currently working at the Department of Public Health as associate medical director for vaccine preventable diseases. So I just wanted to talk a little bit about pertussis, and I have a few slides, if I may.
I will turn that on right now.
Okay.
All right, you should be good to go.
Okay.
Thanks, Angela.
Let's see here. Are you guys able to see the slides?
Yeah, looks great. It's
Okay,
in
great.
we can sort of see the like it's not in presenter mode, I guess is what I would say. But it looks great.
Okay. All right.
I think
Well,
if you do from the beginning or from current slide on the far left
sure,
there.
sure.
There you go.
All right. So I always get the slide sharing wrong, but hopefully you guys can see my slides. So I just wanted to talk a little bit about pertussis because, as you may know, pertussis cases are high in Massachusetts and actually across the country right now. And so, what is pertussis? So, pertussis is a highly contagious bacterial infection. It's also known as whooping cough. Um, it's caused by a bacteria called Bordetella pertussis, and the symptoms are characterized by severe cough associated with the characteristic whooping sound and breathing difficulty at times. So I explained what pertussis is: a bacterial infection causing kind of a cough and a characteristic cough with a whooping sound. Hopefully you can see this chart of case counts over the past 10 years.
We can see it. It's
Okay,
advancing.
perfect. That's great. So before the pandemic, we would typically see a few hundred, 200 to 300 cases in Massachusetts of pertussis. And this was pretty typical. During the pandemic, we didn't see barely any cases at all, of course, because of the social distancing and protective measures we were taking at that time. But this year, pertussis has bounced back with a vengeance, and we're actually up over 600 cases year to date. And of course, the year hasn't ended yet, so we're seeing a lot of cases this year. And I don't think anyone can say exactly why. Um, we think perhaps it's related to waning immunity from vaccines and going back into settings where people are in close contacts, especially schools and things like that. Pertussis is very conducive to spreading pertussis. So I'm trying to move to the next slide, which is pertussis symptoms. So pertussis starts out as a pretty unimpressive syndrome. It's kind of starts out like any like cough or cold. People get runny nose, low grade fever, occasional cough, and that lasts for 1 to 2 weeks. And during that time, even though people are kind of not really that sick, they're still very contagious. After they've been sick for a week or two, they move into the next stage of illness, stage two. And that's when you start to see more of the characteristic of the symptoms that characterize whooping cough. So people at that stage will begin to have fits of cough, uncontrollable fits of cough, which can be followed by this whooping sound, and also, or could be followed by vomiting. And so that's when we, again, start to suspect that it may be something other than a cold, because it's lasting for several weeks, and also the symptoms of whooping and vomiting after coughing. It really points to pertussis. And this stage, this second stage, can last for a good number of weeks. And then after this stage, people move into what's called the recovery stage. People generally start to feel better, but they can still have episodic coughing fits, and this can last for several weeks as well. So with pertussis, people can be sick for um, a substantial number of weeks, up to 12 weeks. But thankfully, most people do recover well eventually from whooping cough. But just wanted to mention that infants are particularly vulnerable to pertussis or whooping cough. So, in fact, in unvaccinated or incompletely vaccinated infants younger than 12 months of age have the highest risk of severe complications and death. And in fact, for infants younger than 12 months of age who get pertussis, about a third of them require hospital treatment. And because pertussis is so severe in young infants, this is the reason why the current recommendations are for people who are pregnant to get a pertussis containing vaccine during the second trimester of their pregnancy so that the pregnant person can produce antibodies, which are transferred to the baby so that when the baby is born, the baby will have some protection against pertussis before before the baby can receive its first pertussis vaccination at age 2 months. So that's the reason for that recommendation. And it's interesting that the symptoms of whooping cough in infants are different than those that are in older people. In fact, infants may have minimal cough, may not have much of a cough at all, may not have the whooping, the characteristic whooping, but what they do have can be pretty dangerous. They can have what's called apnea, which means that the baby stops breathing. So that can be a big complication that causes a lot of illness and risk for young infants, and they can also are higher risk of getting pneumonia from pertussis. So pretty dangerous infection for infants. How does it spread? So the pertussis bacteria is spread from person to person, and happens when someone who has pertussis coughs or sneezes, and these particles get into the air, and then the other person will breathe them in. And the problem with pertussis, as I mentioned before, that people can have mild symptoms, like a cold, and not even know they're infectious, but can still spread the bacteria to others. And people can spread the bacteria from the start of symptoms um, through at least 2 weeks after the coughing begins. So we treat cases of pertussis with antibiotics. And the reason for treating for antibiotics, most people will get better even if we don't treat with antibiotics. But the reason to treat is that it makes the illness less severe, especially if you are treating a person within the first 1 or 2 weeks of their illness. And it also reduces the contagiousness of the illness. So treating with antibiotics makes the person um, non-contagious quicker and reduces the spread of illness. So that's the reason to do it. So we treat people with pertussis with antibiotics, and we also treat people without yet whooping cough or pertussis who are at high risk and that come in contact with a pertussis case. So typically we would treat everybody in the household of a pertussis case. We would treat people who've come in contact with someone with pertussis who has a high risk of developing severe pertussis illness, such as young infants, people who have immunocompromising conditions, people with severe asthma. And we also treat those who aren't sick, but have come in contact with a pertussis case and have and also are regularly in contact with people who are at risk of developing severe pertussis infection. So, for example, a nurse who's come in contact with a pertussis case that works in the NICU, we would treat that person because they could come in contact with people who are at risk. And this also includes child care givers as well. So there are vaccinations to protect against pertussis. Pertussis vaccination is given to infants at 2 months, 4 months, and 6 months of age. Then again at 15 through 18 months of age, and then kind of a booster dose at between 4 and 6 years of age. We also, it's mandated for, and these are all mandated for school entry. And then the Tdap vaccination is recommended or actually mandated by the state for schools for preteens age 11 to 12 years. So during the epidemic that we're seeing now, thankfully, we're not seeing a lot of disease in young children or infants. What we've been seeing is the people who've been getting pertussis have been the kind of the teenagers, the older adolescents. So what we think might be happening is the pertussis vaccine protects very well within the first few years, but after 3 to 5 years, the protection wanes. So potentially these preteens that got the update, the booster vaccine at 11 to 12 years of age, by 14, 15, 16, 17, the protection is starting to wane. And that's actually where we're seeing a lot of the cases. In fact, nearly all of the cases that we've been seeing have been appropriately vaccinated. So the vaccination, the protection for the vaccination isn't from the vaccination isn't absolute, but what we do know is that people who've been vaccinated that get pertussis get milder illness. So there is still a reason to be up to date on the vaccinations. So in terms of preventing the spread, we recommend kind of the same things we would recommend for any other respiratory illness. Immunizations at the foundation. Hygiene is very important, covering the cough or sneeze, frequent hand washing and cleaning high touch surfaces, ventilation. And in this case, and treatment with antibiotics, and also in this case, staying away when you're sick. And we actually strongly recommend, or actually make sure that people who have pertussis have to stay home and out of public settings until they've completed 5 days of antibiotic treatment to make them non-contagious. So people who are sick, people who have pertussis, have to stay home until they're treated for 5 days. And we generally, of course, recommend that people do stay home when they're sick. So that's all I have. I'm sorry about the
I'm
the
so sorry about our technical difficulties too. I guess there was a question in chat, which you answered about is there a test for, well, you answered about vaccine, but is there a test for pertussis?
Yes, yes, there is a test for pertussis. And there are several, not several, but there are a few. The most common test is what they call a PCR test. So if you go into your doctor's office, they swab, similar to COVID, swab the back of your nose and throat and send that. And that's a pretty quick answer. It's a pretty good test. We can also try to culture the bacteria, take the sample and try to grow it in the lab. That takes longer and I think is not as necessarily as reliable. So we usually will rely on this PCR test that, like, similar to COVID.
And then Joanne Gravel shared, I got a DPT shot before I went to visit my new grandson in
Oh
Chicago
yeah.
in June. One can see why vaccine hesitancy can impact these numbers. And then Sally Feller shared, CVS pharmacists and CVS.com recommended Tdap shots this fall. To me, an elder primary
Gosh.
care also recommends. Kim Davenport wonders what guidance might you provide early education staff? And I know that people usually want stuff. Like, is there a one pager that people can share?
I can look for a one pager, but definitely I think the last slide that I sent is appropriate. I think that parents should be reminded if their kids are sick, they shouldn't send them in, even though, everybody's tempted to kind of do that. If a child or a person, staff has a prolonged cough, or prolonged illness, like a cold lasting longer than a week, then definitely they should get checked out and kind of make sure that it's not pertussis, because again, it can kind of be a little tricky in the beginning of the illness to kind of figure out what's going on. Um, yeah, and staying home and then the general uh, hand hygiene and cover your cough, that type of thing. I would recommend. And if you're exposed to, if there's a, I think one of the tricky things is too is if someone, say a child in a classroom has pertussis, trying to figure out the health local health issue local health officials will try to figure out who's actually a contact. And sometimes that can be a little tricky. We don't like to treat the whole class as a contact or the whole school. We try not to do that because that can kind of cause more problems than it solves. But I think in that case, people will be contacted to try to figure out who actually comes in contact with the case and who might benefit from preventive treatment with antibiotics to prevent the spread of pertussis.
I'm sure that's part of the challenge for all this as this season, right? Like untangling, understanding what's what, and then how to get good advice. And we know that folks listen to their childcare providers, and also that as providers, you see is this range of symptoms.
Mhm,
And
mhm.
so it sounds like get tested if you can and
Yeah.
stay home if you're feeling sick.
Exactly, exactly. And it can be pertussis can be tricky, and it's estimated that a lot of adults, in particular with pertussis, the cases are missed because you just assume it's a cough or a cold, and people
Right.
just go on with their life. So, yeah, and it's mixed in with a lot of other stuff, like you said. So
That's great. I guess like in bigger picture, are you seeing more flu, more colds? Like how is that all playing out right now?
yeah, so right now we're not seeing a lot of flu, COVID, or RSV at this point, which is good. So that is good. We're seeing a lot of pertussis, and we're also seeing another infection called mycoplasma pneumonia. So the pediatricians have reported to us that they're seeing another bacteria that's circulating in younger children, which can cause kind of pneumonia type symptoms, which are different than this, a little bit different than the symptoms that we talked about with pertussis. This is more fevers and people feeling more ill. So that is circulating at higher levels than previous. It's one of those things similar to pertussis that can be kind of a cycle. Some years you see a lot of it, some years not as much. So we are seeing that. We're seeing pertussis and mycoplasma pneumonia, but not yet flu, COVID, and RSV. So now is the time to protect yourself from those before
So
that
that's
gets
about getting the vaccines, right?
exactly.
Donna Dennett adds our out of school program has seen a rise in pneumonia.
Mm.
And Sally added lots of folks think cough is a symptom of long-term COVID.
It
Right,
could be, but you definitely get it checked out for sure.
right. Well, thank you so much for your patience, everyone, all the 9:30 callers, as my Zoom updated, Marissa logged in, and the slideshow got set. So if you send us the slides, and that's good advice that folks can use that final slide
Sure,
to share with parents as well.
absolutely,
And maybe
absolutely.
we'll look forward to booking you maybe as we get further into winter and
Happy
hearing. It's
to.
so
Yeah,
helpful to hear just kind of breaking it all down. So really appreciate that.
no problem. Happy to be here.
Okay, everybody, we will see everyone tomorrow is election day. Make sure folks are out voting and spreading the word. Take care. Thank you.